Hi, my name is Amanda Ellis, and this is an instructional video on how to do a pre- and post-operative assessment on a cervical spine patient in the hospital. This is in partial fulfillment of the requirements of Nursing 5309, Teaching and Learning Strategies at the University of Texas at Arlington College of Nursing. My helpers today are Al, my patient, and Sue, the nurse. Today we'll be learning and discussing how to do pre- and post-operative assessments. The first question you may ask is, what is the cervical spine? The cervical spine is made up of 7 vertebrae that contain 8 pairs of cervical nerves. These cervical nerves are very important and control many different body functions. This can be emergent when they are injured. For example, I took care of many trauma patients in the past who were unable to breathe after an injury concerning C3. Many people in the United States have surgery every year for cervical injuries. Why else do you need cervical spine surgery? The most common reasons are pinched nerves and herniated discs. Over time, patients can develop spinal stenosis, and of course, there's always trauma. Signs and symptoms of cervical spine injury can include pain, numbness, weakness, and tingling. It is crucial to document these in your hospital's documentation, not only because, well, post-operatively we have to know if there's a problem, but because if it's not documented, it wasn't done. The most common surgery for cervical spine, is the anterior cervical discectomy and fusion, ACDF. Hardware is placed in the neck to help stabilize the area of the fusion. This can be plates or screws or pins, and this keeps the spine from moving through this anterior approach. This hardware provides support to the neck and helps the bones grow together easily. Your patient most often post-operatively will have a collar on, so it is very important not to let them move their neck after the surgery. Now for the assessment. Over my many years as a nurse, I've seen many different ways of doing this assessment, but we're going to cover the one I've seen and used most often. Sue is going to have Al do the pre-op assessment. C1 and C2. It's the head and the neck. So simply ask your patient to turn their head side to side.
Can you turn your head to side?
And up and down. Notice any difficulties in range of motion, any pain that this causes. C3 is the diaphragm. Well, there's no real test for the diaphragm. If your patient is breathing, they're probably okay. C4, the nerves that come off of C4 control your upper body muscles. This one is a little bit lengthy, but it's most often missed. What we're going to do first is have Sue ask Al to grab hold of her hands and pull her toward him. Notice the strength and the equalness of the strength on each side. Now, Al, I want you to push Sue away. Notice the strength and the equality of movement. This is the biceps and triceps. Now, I want you to do the same thing, only with your wrists. Flex your wrists, push her away. Now I want you to turn your wrists over and pull her towards you with your hands. Good. This covers C5 and C6. C7, the triceps, we already did, but if you want another test, which I've seen done before, you can ask the patient to raise and lower their arms. Very good. And if they have the range of motion, which many people don't do, they can place their arms behind their head and raise and lower their elbows. Perfect. C8 is the hands. This is a simple hand grip, which most people assess as they're doing the other assessments. Grip together. Perfect. Now make sure you ask your patient any numbness, tingling, weakness while they're doing this, or pain.
Do you have any numbness, weakness, tingling?
Not today.
Why is this pre-op assessment important? Why would you think it's important? To establish a baseline, correct? I've taken care of several patients, and upon waking, one particular example, the patient could not move her right arm. The surgeon, of course, was concerned, anesthesia was concerned, nursing was concerned. We asked the patient if this was a known problem, and she said, well, yes, I haven't been able to move my right arm in about 5 years. The problem with this situation was, no assessment was done preoperatively, nothing was recorded. This should have been a known issue. Again, in the ICU, after surgery, I had a patient who had some complications. When she woke up a day later, because she needed to be ventilated overnight, she had tingling in her left hand. Was this known? Was this an issue that was surgical? The surgeon thought so. The patient ended up having unnecessary tests and CAT scans because of something that was known preoperatively and never charted. Nursing 101. If you don't document it, you didn't do it. This is an important example, based on stories and learning from the past, of why it is crucial to do an accurate and thorough preoperative and postoperative assessment on your patient. It is also crucial to give report. The pre-op nurse should give report to the operating room nurse, and the operating room nurse should give thorough report to the postoperative nurse, whether that is recovery or ICU. Thank you so much.